Hi, this is Justine Calderwood, physical therapist here at the Healing Spot, and today I want to show you a release for your SI joint. So what is the SI joint? I have just a little pelvis here, so as I'm sitting here it kind of looks like this, right? So the SI joint, if I turn this pelvic model around, you're going to see the sacrum, okay, which makes the S of the SI joint, and the ilium, or the hip bones. So really the SI joint is kind of those dimple areas in your lower back, okay? It's below the low back though, okay? So if you have an SI joint that kind of locks up or gives you pain on occasion, I want to talk to you about how you can release this, okay? So I'm sitting on the floor and I'm next to a wall, but you could certainly do this on a door, or even if you needed to lie on your bed and use the wall next to your bed or your headboard, you could certainly do this. So I'm going to show you how to release the SI joint, and why would you want to do this? Again, low back pain. You might get pelvic floor pain or have pelvic floor dysfunction. You might have a history of sciatica, okay? So I'm going to show you how to release this one simple way, okay? So I have a small inflatable ball. I'm going to show you with that. But I also I'm going to show you a couple different ways. You can pick, when you do this at home, you can pick how you might want to play around with it. I also have a yoga block, okay? And I also have a foam roller. This is a 36 inch, and I believe it's like a 6-inch diameter. So if you have a foam roller, I don't advocate for rolling muscles out, but I use foam rollers on occasion for position, okay? So what you're going to do here is you're going to lie down and your feet are going to be on the wall. So the best way to do that is to sit next to the wall first. You're going to roll onto your side and you're going to bring your legs up onto the wall, okay? So if you have tightness in your legs, you might want to scoot out away from the wall. Ideally, you want your legs to be straight if you can to start with, okay? So what you're going to do is you can just bridge up a little bit and you can find your kind of that dimple area, and you can put your ball, that little small ball, put it right over your sacrum, and you're going to rest down onto the ball, okay? Legs are going to be on the wall like this. And what you're doing is you're just trying to, almost like you're allowing that sacrum to lift up towards your feet, okay? And the other part of your body to lift out this way. So it's more of an intention. You don't have to do a lot of like stretching, okay? So that's one way. If you have a really inflamed SI joint, I recommend getting a small ball at the dollar store, or if you're a patient of mine, you should have one of these. If it's not so acutely tender to you, you can use a little foam yoga block. Again, just bridge up, and you want to put that foam block like right underneath the sacrum. So it's not your low back, okay? It's a little closer to your butt area, okay? So you can rest there, and then what you can do, that's going to kind of lift your sacrum towards the wall, and then you can bring your knees down and just rest there. So it's almost like your sacrum is going up this way, okay? So that's a really great way to decompress the joint, okay? Same thing can be done using a foam roller. So if I bring this here, I can bridge up. I'm going to put that foam roller up underneath. So keep in mind the foam roller is going to move, okay? So that's why the yoga block might be the best for you. And you can get them at Walmart for like $5, okay? In the sporting good aisle. So from here, you can again just bring your knees here. You should be able to rest here without a lot of effort, okay? Again, that SI joint is kind of decompressing towards the wall here, okay? So you can just hang out here. So when we do releases and we do a myofascial release, we want to make sure that we're holding long enough. It gives the body more of a chance to make more permanent changes in the body. So when we do myofascial stretching or releases, we want to hold for a minimum of 3 minutes, but ideally for 5 minutes or longer. However, if you're in a lot of pain and you're not able to rest down in this position for a minimum of 3 minutes, I give you permission to listen to your body and stop the release at any time, okay? So if you're doing this, set a timer on your phone, whatever you need to be able to hold for that 3 to 5 minutes, okay? And you're just kind of hanging out. So I'm not going to hold this for the whole time. But what you want to do when you're done is you want to slowly come out of the position, because you've just now given it a lot of decompression. So ideally, feet back on the wall, okay? And you can bridge up and get rid of whatever thing you have underneath you. And allow yourself to rest down onto the floor, okay? Give your body a chance to accept that, the weight back into it. And then you can roll to your side and you can sit on up, okay? One thing I forgot, hold on just a second. I've been trying to pair the releases with an essential oil that I recommend. So the one that I would recommend if you have occasional aches and pains is Young Living's Pan Away, okay? It's a really great one for helping to support the physical body and with minor aches and pains, okay? So you can put that directly onto the SI joints or wherever you're having some discomfort, okay? It's a blend. It's got peppermint and clove and helichrysum in it, and it's really good for helping with occasional pains, okay? So that's all I have for you. If you have questions, please leave them below. If you want a little more guidance, you can head to my website and download my free guide on low back pain, okay? So you can head to healingspotpt.com. You can download that for free and get a little bit more guidance as well. So thanks for tuning in. See you next week.